Welcome everyone. Thank you for joining our session this morning or this afternoon or this evening, whatever it might be for you. I'd like to welcome you to today's presentation. I'm Laura Clark Murray. I'm the Partnership Officer with Omdena, and I'll be moderating the session today in partnership with Devika. And on behalf of all of Omdena, I want to thank you for joining us. So today we're talking about a project to explore the use of AI and data-driven analysis to understand the impact of COVID-19 policies on vulnerable populations. And I'd like first to just explain a bit about the session so you know how it's going to unfold. I'll take a moment or two to give some background on the problem, the issues we were addressing. Two presenters today from the technical team who will present for about 40 minutes, and that will be followed by a Q&A session. We'd ask you to please enter your questions in the chat while the presentations are going on, and we will do our best to answer as many as possible. I also want to let you know that we'll be following up with everyone after the event and sending out some of the insights and so on from the project. So you have plenty of opportunity to interact with us. So first, some background on the issue we've been looking at. So as the pandemic crisis hit, governments around the world made halting the spread of COVID-19 their top priority. Stringent policies of social distancing and quarantines were introduced and implemented, and normal life came to a halt. Now, while these policies have been introduced across the globe in somewhat similar ways, the impact on different populations was not necessarily taken into consideration. And now we see that some of the most vulnerable have been especially hard hit. For this project, Omdena brought together more than 50 AI engineers, data scientists, and domain experts from 27 countries for an intensive 8-week collaboration. Our partners include AI for Peace, PWG, and experts from the World Health Organization, the UN, and those who were deeply involved with the worldwide Ebola response. We are extremely grateful for their input and guidance. Though looking to technology and data isn't new for policymaking, the world of AI and data are different than they were at the time of other health crises such as SARS and Ebola. AI and data can be used in ways that just weren't possible in the past. And with that, there's an opportunity to have an impact on policymakers in this current pandemic and hopefully in future crises. So while we have not created a set of AI models ready to hand over to policymakers, we believe this work points to areas where data science and AI techniques can bring value, and we hope it acts as a signpost for future work. So the purpose of today's presentation is for the data science and machine learning team to share the approach that they took to these issues and the findings of that work. We're so appreciative of the amazing work, the time, and the energy that this incredible team has put together to tackle such important issues. So a reminder to please post your questions in the chat throughout the presentation. And now, before handing off to the presenters, I'd like to introduce Nicholas Holmberg. He's a managing director for NASDAQ, and he has a few words to say. So Devika, if you could make Nicholas the host, please, for a moment, and unmute him. Okay, we're getting there.
So, hello everyone. Do you hear me?
Yes, we
Yes.
hear you, Nicholas.
So nice to meet you all. I know that all of us come all around the world, and we have different way of facing this unique situation. And that you probably read about that Sweden, we have chosen a little bit like a different way of a more like an open society related to Corona. Maybe later on, maybe in 1-2 years, we will see what have been right or wrong. But what when I'm talking about what we from NASDAQ, and I'm responsible for the listings in the Nordics, but NASDAQ really appreciate all this amazing initiative that goes all around. Everything that you meet, companies on the street trying to do small things to larger companies doing big things, and we are, the exchange are demanding of strong opportunities, entrepreneurs that try to meet this extremely hard situation with a lot of good solutions. And Omdena is a very good example that we want to highlight. So a few weeks ago, they were one of few companies that we decided to put on NASDAQ Times Squares. And we know that there are so many other companies doing a lot of good things. But it was important for us because you have a very broad international view. You're working in so many geographical areas and try to get everyone to be involved and do something better for the world. And that is what we believe at NASDAQ as stock exchange, that we need to do this together. So we are so happy to, in any way we can, support you guys with not necessarily good advices, but visibilities or examples or ideas of how we can make this world better in this extremely hard time. So again, maybe you were proud to see your brand on Times Square. I think it was even better for me and my friends, and it is not just you, it's a lot of good companies that do good things, and to be a part of that and feel the community that support the lives going on in a nice way. So everyone here joining this call, I hope everything that you can believe that the NASDAQ, the stock exchange, can do to improve this environment, feel free to connect to Laura, and she can give me the email and we can start talking, because I'm happy again. Yesterday I was out and having dinner and we were 15 people, business people, females, young, old, and we had the great discussion. What can we do right now? And I know that this is not the situation in the rest of the world. So feel free to come back to Laura. You have my email, and good luck with everything what you're doing. Thank you.
Thank you. Thank you so much, Nicholas. We appreciate those thoughts. Okay, and now what I'd like to do is hand this off to Arthur and Kritika, who will be presenting the work. And just a reminder to please add in your questions all throughout so we can hand them over to them during the Q&A. Okay, over to you, Arthur.
Okay, great. So I'm going to share my screen. And I'm going to present. So thank you, Laura and Nicholas, for your inspirational opening remarks. I'm going to start this presentation, and it's really just a survey of what we've been working on for the last 2 months. The title is Understanding Policy Effects on Vulnerable Populations During Pandemics. So a special thank you to Omdena, which is a global AI platform for tackling these real-world challenges. They typically pair people like me, data scientists or AI researchers, with domain experts. And in this challenge, we had 3, Branka, Chris, and Mauricio. I want to give a special thanks to Mauricio for really guiding this challenge. So as we're all aware, we're in the midst of COVID-19, and the effects of COVID-19 can hardly be overstated. It's affected all continents and within a short time period. You can see here, this is just a simple graph showing the number of cases. We can see that there's just an exponential increase in the number of cases over the span of a month. And so what we can see is that COVID-19 really represents a watershed event. It's going to challenge us as scientists or business people to really look at how to study global systems and interactions, the use of social and economic data, and really how to develop data-driven policy. And so the problem statement of our task was as follows. The World Health Organization called on governments to take urgent and aggressive action against COVID-19, with many governments reacting with strict measures, such as closing borders, quarantining entire cities. So the goal that we had was, how do these policies affect the well-being of vulnerable populations? And this is really essential to understand that as a challenge that's looking at not just countries, but the people who could be affected the most. Vulnerability is a very important component to track. So when we began this project, it was very difficult to at first really limit what we would study. And so we looked at what are the factors affected by the policies. And through a lot of debate, we were able to reduce that down to 4. So we were considering how policies affect vulnerable populations for employment loss, wage loss, access to health, and domestic violence. And so what we're trying to study here is, if you have a vulnerable population and you apply some policy, how does that affect their state in terms of their domestic violence or their wage loss or access to health or employment? And so we tackled each of these tasks individually. And then we looked at, what does it mean to be vulnerable? And so our level of analysis was cross-comparing countries. And some example metrics consisted of, for example, Inequality Adjusted Human Development Index, IHDI, population over 65 years old, or in the case of domestic violence, women. And this is just a graph, or this is just a chart showing the IHDI ranking of different countries. We can see that a lower IHDI indicates lower Human Development Index. So this would be countries that could be more vulnerable to the attack of COVID-19. And then countries that have higher HDI might be more robust. So after really thinking about vulnerability, which took actually about 2 weeks to narrow in on, we decided what policies. So how do we actually study the effect of policies? And so we came across the Oxford COVID-19 Government Response Tracker, which systematically measures worldwide policy responses of governments. It's updated daily. And so what they do is they track 17 policy factors focusing on containment, economic response, and health systems. So some examples of containment: we have school closings, workplace closings, stay-at-home requirements. So we can construct a measure of lockdown. We have economic responses such as income support, and we have health systems such as contact tracing. How it was measured, each of these policies, was on an ordinal scale from, let's say, 0 to 3. So in the case of school closings, we can see that the level of intensity of the policy can vary between countries. For example, it can be 0, which is no measures, or it could be 3, requiring closings of all levels. And so, so as the team, we have the factors, we have the vulnerability, we have the policies, and then we went to look at employment loss, wage loss, access to health, and domestic violence. So let's start with first describing how a little bit more detail about how the policies were used in each of these tasks. So again, we're using the Oxford Government Response Tracker, and so we measured the time of policy enactment. So this is comparing when policies were taken and their effect on a target variable. Also the stringency metric, which is a measurement of total intensity of all enacted policies. So this is, you can think of it roughly as summing together all of the policies If they have higher intensities, that relate to a higher metric. And we also looked at Google's mobility data set, which quantifies the movement of people and places. So this is a way of also looking at how policy enactment, for example, quarantine measures, actually is affecting the livelihood of people in real time. So this is an example case of how we're able to use the policy information in addition to a target variable, which in this case is the number of daily cases of coronavirus. And so the x-axis is actually the time starting in February and ending in May. And so we can see that as time goes on in the United States, there's an increase in what types of policies and their intensity. And we can actually record when these policies were taking place. Furthermore, we can cross-compare against other countries. So for example, this is South Korea, and we can compare what types of policies they enacted. So for example, contact tracing was a little bit more heavy in South Korea versus in the United States, they were less on contact tracing. And we can measure the effect on how many cases of coronavirus. Another thing we could do is we could look at how policies are affecting the movement of people. So for example, we have a lot of restrictions for example, workplace closures. And so in the United States, we can see that the mobility of the very people has changed. So over here, we can see that there's 6 categories. There's retail, grocery store, pharmacy, parks, transit stations, workplaces, residential. And we can see the only one that really maintains is residential, parks, and grocery and pharmacy, while the others have decreased. And we can compare, for example, to India, which had a little bit of a stricter measurement. And there's a sharper decrease that can be seen. And so the real take home is that we have the policy measures. We also have target variables, such as coronavirus cases. And we can really cross-compare over countries by laying these 2 data sets over time. So now that we've understood how policies are used for measuring our target variables, we can be interested now into what are some of the tasks that we looked at. So the first one we looked at was employment loss. And this was an especially salient task. There was featured many headline news articles and is currently being debated the effect of coronavirus on employment loss. So what we looked at is how income support policy affects employment loss. And then we did an analysis of vulnerable countries ranking by IHDI and what's called informality rate. We can see in the United States that as time goes on, there's just a huge increase in unemployment rate. And if we were to look at the specific policy of income support, we can see when the United States, so this is over time. This is the income support policy when it was enacted. So on March 24th, it went from 0 to 2, meaning that the government is replacing more than 50% of lost salary. We can also cross-compare it with the total stringency. So this is all the intensity of all policies that have been enacted. And we can compare the timing of these 2 graphs. And so when we cross-compare against other countries, so for the United States, there was a huge increase in unemployment rate. And we noticed, just an observation, that if we were to look at Sweden, for example, when they imposed an income support measurement a little bit early on in comparison to other policies, such as lockdown. And we can see that there's a little bit of a flattening of the unemployment rate. Similarly, in Belgium, we can see that they enacted income support much early on, and it resulted in a much flatter unemployment rate. And so we can see that the timing of the policy has a suggested influence on the unemployment rate in terms of stabilizing the economy. So this is an interesting finding that we saw, in comparing when policies are enacted and how they affect a target variable, in this case, unemployment. So the lesson is that we gained is the timing of government aid correlates to reduced employment loss. But the question that's raised is, so how can we identify vulnerable with respect to income support policy? So income support policy may affect individuals of the economy or the labor force differently. And so we wanted to look at specifically high impact sectors. So these are sectors that are going to be really targeted by coronavirus. This is such, for example, accommodation of food services, real estate, manufacturing, wholesale, and retail trade. And then we wanted to compare against different countries. So this is Lagos, Nigeria, and this is Seoul, South Korea. So we could see that perhaps there would be a difference in how quarantine measures and income support might be different for these countries. And similarly, with the rate of the informal economy. So these are jobs that are not recognized by the government, such as being a street vendor versus being in a more recognized sector of the economy. So we wanted to also compare how this would affect vulnerability. So here is a chart of featuring different countries. These countries were already selected to be considered vulnerable. So that is meanings that they have stringent lockdowns in place, little to no income support, and workforce in high impact sectors. So these are the countries that would be considered vulnerable. What we're able to additionally do is weight each of these countries by their IHDI. So for example, a country with low human development that's quite intense might be Nigeria, or similarly, maybe medium development would be Honduras or Bangladesh. And we're able to really bring out this a measure of vulnerability through this graph. So on the x-axis, we have a share of labor force participation in highly impacted sectors. So these are just the percent of the labor force that's going to be in manufacturing, for example. And then we have the stringency index, which is just the policies that were enacted and how intense maybe the lockdowns measures are. And we can see that if you move towards the top right, you're going to have more highly impacted sectors with more stringent indexes in terms of the policy. Finally, what we did is we color-coded each of these countries by IHDI category. And then we increased the size by a measure of vulnerability. So the size of each of these country points is weighted by the number of workers in high impact sectors times the inverse of the human development index. So if you have low human development index, you're essentially going to have a higher circle size. And so we could start to kind of identify countries that might be adversely affected by these coronavirus policies. For example, Nigeria, that has low human development index and a lot of workers that are in, like say, manufacturing and retail. And similarly, Guatemala, which has more stringent policy and also perhaps even a higher percent. So we can start to kind of see the topology of the world in terms of how we can kind of measure vulnerability with respect to policy. We also looked at informality rate. And so this is the same countries, but it's ranked by informality. So the informal economy is the neither taxed nor monitored labor of, it's either taxed or monitored by the government. These are jobs such as a street vendor. And the informality rate is the ratio of the informal labor to the total labor force, okay? And so we can make a similar plot except with informality rate. And this is especially useful because informality rate is receiving no government assistance, or perhaps little, because it's not recognized by the government. And so these sizes of the circles, which has increased a little bit for Myanmar and Bangladesh, may actually reflect more information about how a policy will affect the vulnerable populations. And so some of the lessons that we take home from the employment loss is that we can see that the timing of government aid correlates to reduced employment loss, so the timing matters. And we're also able to kind of characterize vulnerability of by IHDI or informality rate over countries. And so this is useful for identifying which groups to attend to when applying policy. With that having said, I'm going to switch slides. Kritika will now present.
Thank you, Arthur. Just give me a second. Let me share my screen and then we'll start. So the second factor that we have covered in our analysis is the wage loss. And what do we actually mean by it? Arthur did a comprehensive analysis on the unemployment rates in various countries. But what about the people who are employed, but still they're not getting the daily wages and they're not able to support themselves? This is another question that needs attention. So we have covered it under wage loss. So the objective of our analysis was mainly to study the impact of COVID-19 policy measures on wage loss. The data sources that we have considered are the mobility trends, the various underemployment indicators, and the daily confirmed cases. So this graph is demonstrating the scenarios of two different countries with a variety of policies as diverse as it can go. So here, the orange line, it is signifying the changes in the mobility as the containment policies were enacted. The red line, you can see, it's showing the changes in the daily number of cases in both of these countries. And the third, the green colored line is showing the surge in the underemployment rate of these countries. These are two different sets of countries with diverse set of policies. But what you can see here is that as soon as the containment policies were enacted, the underemployment percentage surged like anything. It happened in the case of South Korea, and it happened in the case of United States as well. So no matter what set of policies are being implemented, people are still underemployed. They might not get the daily wages. So a key takeaway from this analysis was that implementation of closures, lockdowns, and a decrease in the mobility, it is showing a very negative impact on the wage loss, which will directly impact large loss in the informal sector. Now, this graph illustrates that the daily wage loss estimates that the team did. So here we are considering 7 countries: Colombia, Ecuador, Honduras, Nepal, Serbia, Thailand, and South Africa. And the daily wage loss estimates range from $1 per day to $8 per day. So this is how big the problem is. You might wonder that maybe some countries have implemented policies to support these people. So this is illustrated here. So here, as you can see, the purple lines in the graph, they indicate the wage loss estimates of 2 countries that we have considered, Thailand and Colombia. The green colored line in the top graphs, they signify the stringency index. So stringency index is basically a measure of the implementation of the policies. In the bottom graphs, the green line signifies the confirmed cases. So here, what you can notice is that in the case of Thailand, when there was no policy implemented, you could see that wage loss was already occurring. In the case of Colombia, after they enacted the policies, did the first surge of people suffering wage loss occur. Thailand enacted the policies in a wide span of a month, while Colombia was a bit more aggressive. So they implemented the majority of their policies in the time period of 15 days. Moving downwards, so here you can see the green lines representing the confirmed cases in both the countries. And when we compare it with the wage loss estimates, we can see that in the case of Thailand, the confirmed cases were increasing, and the wage loss estimates were increasing as well. But in the case of Colombia, the peak has not yet hit, but there is a continuous surge in the wage loss, people suffering wage loss. Finally, there is the ending, the period around May, there has been a downward fall in the wage loss. So this basically signifies that the economies in these countries have been reactivated. The policies have somewhat been relaxed. People are going back to their work and earning their daily wages. So there has been a slight reduction in the wage loss estimates. So a key takeaway from this is that governments might have enacted a set of economic policies to support the vulnerable population, but it's having little impact on the wage loss descriptors that we have studied. Now, let's consider another factor that is pretty integral around the entire COVID-19 scenario, that's access to healthcare. So in access to healthcare, what we have basically done is we have segregated our analysis in two different steps. First is related to the pandemic, and second is the effects of pandemic on the people who are not suffering from the disease and what problems are arising in this. So the data sources that we have considered here are the health statistics of various countries. We were fortunate enough to get the non-COVID data for England and Wales, and hence we have done a comprehensive analysis on that. We have considered policy data sets and the mobility data set as well. But before proceeding forward with the analysis, I would like to point out one thing. So here we are considering a different set of factors, like different domains. So when we are defining vulnerability, so the definition of vulnerability will change as we move from one factor to the other. In the case of access to healthcare, vulnerability means people who are above the age of 65 years. The healthcare and access quality index of the country. So this index is in a range of 0 to 100, and it's basically estimating, it's normalizing the total number of deaths in the country because of various reasons, and giving us a number in the range of 0 to 100. Then the availability of doctors, nurses, and hospital beds is crucial as well. Finally, we have considered the probability of dying between the ages of 30 and 70 due to various medical reasons. So this is how we are defining vulnerability in terms of healthcare. Now, we did a thorough analysis on the various metrics related to medical infrastructure. So here we have considered the availability of beds per 10,000 population, same the availability of doctors, probability of dying, and the health access and quality index. The quick takeaways from this analysis were that if the infection rate is low, so countries with a good medical infrastructure, there is a very high correlation between the infrastructure and the recovery rates and the death rates. But a more dominant factor that emerged is the age factor. So if a significant amount of people in that country are above the age of 65, that's where we are considering vulnerability. So even a good medical infrastructure won't be able to protect these people. Now let's move forward to the case study that we have done on England and Wales. So here we are having data starting from the first month of this year, that's January. And now you can see that there is a decrease, like there is almost constant average of deaths in that region. So here, the people who are dying because of non-COVID scenario, so it's almost constant. But as we move forward, so in the red oval, so here you can see that there is a sharp increase in the average deaths in these during COVID months. So what does it signify? So this is an integral question. People are dying when the pandemic is going on. So now another way we can demonstrate this further is the total number of non-COVID deaths in various places. So here we have segregated we have 4 places: homes, hospitals, care homes, and communal places. So homes are the bars in the purple color. Hospitals are the bars in the blue color. Care homes are with the gray color, and red colored are the communal places. So here, what you can notice, if you just consider the hospitals, so the deaths in the hospitals has significantly reduced as the pandemic began. However, when you go to care homes, so there has been an increase in the care homes as the pandemic began. The same can be said for homes. Earlier, there were not so much deaths as homes, but as soon as the situation worsened, so now the deaths have increased. So what can we see here? So there is a downward trend in the deaths in hospitals, but there is a very noticeable upward trend in home care deaths of non-COVID patients. So another analysis that we have done is in regards to the non-COVID mortality rates, the enactment of the government policies, and the public mobility changes from the mobility data set. So here, what you can observe is the orange line is signifying the mobility changes. The black line is signifying the deaths related to COVID. The blue line is signifying the stringency index, and the brown line is signifying the attended appointments. Here you can see that since the last week of February, there has been an acute cancellation of appointments, changes and cancellations. So there is this downward trend. And when we are associating this appointment status with the stringency index, which is for policies, and the mobility index, so there is a very clear correlation. So what you can notice from this extended analysis on England and Wales, these are the following pointers that we were able to find out. So the average deaths in the months of the pandemic of non-COVID patients, it has significantly increased. The government policies on the high death rate, so these policies are actually keeping the vulnerable population away from hospitals. They need medical attention, but they're not able to go to the hospitals, and they are dying at homes or care homes. Another thing that you can notice is that there is a potential cause of increase in deaths because of appointment cancellations and lack of access to healthcare, which is our agenda. Also, there is a spike in the non-COVID death rate as the government policies and mobility restrictions are entrenched. So now let's move to the final factor that we have considered, that's domestic violence. The main objective of our study was to understand the impact of COVID-19 policy measures on domestic violence. So the data sources that we have considered here are news articles, the policies data set, mobility trends, and the domestic violence search rates that we were able to extract from Google Trends. But how is this problem so integral, and what validates it? So we were able to find out some reports from the United Nations, which are, I'd like to state them. So in countries like France, there has been a 30% increase in domestic violence reports. In Argentina, there has been a 25% increase. Cyprus and Singapore have had an increase of more than 30%. And the same can be said for Canada, Germany, Spain, UK, and the United States. So to validate this further, we collected a lot of news articles starting from the month of when the pandemic began, and then we saw how the frequency of the articles are changing. So here on the left graph, we are having the total number of news articles that are printed in relation to domestic violence. So as you can clearly see by the red line, there is a huge increase in the total number of articles that have been published. Now, if you move to the graph on the right, so here we are considering the ratio of the articles, which means articles related to domestic violence divided by the total number of articles that have been published during that time period. So initially, only 1% of the world media was covering domestic violence. But as the pandemic began, 3%, so there was a 2% increase in the articles related to domestic violence. So these things prove that policies related to COVID-19, their enactment, is having an adverse effect of domestic violence, and it is a growing shadow pandemic. Now, let's move forward. So we have done an extended analysis on the different countries on the basis of their search rates. So here we have 2 countries, and we are comparing the decrease in mobility with an increase in the Google search rates of the countries. So here, the brown line signifies the domestic violence search rates. The purple line signifies the workplace mobility in that country. So Japan is considered as an exceptional case here. But if you go to Vietnam, in Vietnam, as soon as the workplace mobility, so when it came down, so there was a sudden surge in the domestic violence search rates, which can be illustrated in the diagram. To prove this further, let's go to an extended analysis of France and India as well. So in France, there was a sharp decrease in the workplace mobility because of the containment policies. And here you can see that the domestic violence related search rates, they were very high. The same can be said for India. As soon as the workplace mobility decreased, there was a continuous increase in the domestic violence search trends. So what do we actually mean by this? So here we are mainly trying to state and make this point clear that these results, they are indicating that what's being covered by different organizations, a 30% increase or 33% increase, this can be much more than that. And the search results and the trends, they're saying as such. So the key takeaways from this analysis were domestic violence again is a growing shadow pandemic, and we need to focus on that. And countries, a lot of the countries, they're having a very strong relationship between a decrease in the workplace mobility and an increase in the Google search rates. So that's about it. Now, Arthur, you would like to take on.
Okay, great. Yeah, thanks, Kritika. That was excellent. So we showed 5 tasks, and that's varying from economic loss, wage loss, there was domestic violence, and then also access to health. So 4 in total. And so what we can conclude from our study and analysis of each of these tasks are as follows. So we can show that through cross-comparing policy information, economic information, instances of domestic violence, we can cross-compare data sets over time, and that we can look at the timing of policy enactment as mattering. So in the case of domestic violence or employment loss. And so we can study the trends of how the policy may affect the state of society. Furthermore, we were able to characterize vulnerability that was dependent on the policy. So for policy-specific, there's policy-specific vulnerability types. For example, informality rate for income support, or plus 65 years of age for lockdowns, or as also women. And so this really calls for a need for frequently updated health and economic data to help make this our analysis a little bit more robust. Okay. So some of the challenges specifically for data-driven policy is that there's a lack of, data sparsity, so not recording data at regular time intervals. This was the case for some economic indicators, such as there's economic indicators that are reported annually or just monthly, and that's not sensitive enough, especially in COVID. There's also bias in not recording data for the target vulnerable groups. So for example, and I've seen a lot of most of the comments is that how do you track the informal economy? How do you measure them? And it's quite difficult because this is the part of the economy that isn't going to be heard in terms of recording data directly from them. So a lot of methods may use like cell phones, for example. You may not have a cell phone. There's also noisy estimates. So this is in confirmed cases. There's a huge discrepancy between confirmed cases and testing that was explored. So if you're a country that's not testing, you really don't know how many confirmed cases you have. And then finally, there's this relationship. We really can only draw a correlation, but not causation. And this is because we're not accounting for untracked relations, such as how the disease is propagating or the information across countries. But if we were to think about this as motivating potential AI applications, we can see that what we really want to focus on is what data do we have available and how we can leverage it. And so graph, or the chart on the left is just showing it's really just showing the probability of infection rate as it's connecting different airports across the world, starting from China's Beijing airport. And so we can start to think globally about studying global systems and models, and how can we really start tracking information spread, disease propagation, or other things like that. And so there's a few areas that I offer as potential avenues for exploration. Natural language processing. So we showed for the domestic violence case that you can study trending topics in news articles and people's reactions and sentiment to those news articles. And that's a way of addressing maybe cultural or social state. So the state of, for example, people who are suffering from domestic violence. We can also consider maybe graph neural networks as measuring country-to-country relationships, such as disease propagation or influence. And so this is going to structure information in terms of graphs, which is very suitable for countries. This is a graph in terms of representing edge relationships between individual countries. We can finally consider maybe image processing for extracting information from satellite images. And so this has been done by Planet AI, for example, is a company that does that for poverty mapping. So this might be an alternative method for extracting information, for gaining information about the state of the world. I think a few people have mentioned locusts affecting certain countries. Well, maybe you can measure the effect of locust devastation on crops from satellite images. So for future work, what we suggest is data-driven policy. So how to create data infrastructure to link policies to health and economic outcomes. So this is, again, suggesting that maybe we need to measure data more frequently. Maybe we need to make trends, cross-compare data sets over time. We can start doing that analysis. We should also perhaps look into the direction of studying global systems. So how to study the effect of an event, such as a pandemic, on a global scale. This could be other events, maybe tariffs or other types of policies. We can start asking these questions. And then finally, this is how do we generate data cheaply, frequently, and accurately? And not just for one part of the population, but for the vulnerable as well. And so these are really pressing challenges and areas for growth as we studied in this project and perhaps for future projects studying data-driven policy. And this is the list of all the brilliant minds that have been working on this. It was a real pleasure working with each individual from around the world. And the next slide. This is everyone. So thank you very much, and we're looking forward to your questions in the Q&A.
Okay, thank you so much, Arthur and Kritika. Really appreciate that. Thank you for all the excellent questions in the chat. We we'll get started on that, and we'll stay around a little bit extra for those who have the time to do that. But we appreciate knowing what those questions are, and we'll get back to people. So now what I'd like to do is hand over to my colleague Devika, who's acted as the project shepherd for this and is intimately involved with the project, and she's going to oversee the question and answer. And just before I hand to her, I will post in the chat a couple of things regarding our next demo day, which is on June 16th, and also some links where you can keep up with this work. Okay, thank you. Handing over to Devika now.
Thank you, Laura. Thank you, everybody, for being such a great audience. The first question is from Ruud Vermeulen, whose question is pertaining to data availability. So his question is that vulnerable populations work in the informal sector, which are not well covered in official employment statistics. So do you use proxies to cover that? I was thinking maybe Arthur, Kritika, or Reem can answer that question for us.
Let's see, I don't believe Reem is present.
Sanchit might be present. He was actively working on the task.
But in general, that's a great question. And I think many of our statistics in the past have been reliant on census data, which is gathered at not frequently enough or comprehensively enough. And so I think really what should be explored is how can we generate data cheaply? And I was suggesting that satellite images might be a way of doing poverty mapping, or for example, crop yield for agriculture in the case of, like, let's say, locust attacks. So they'll allow us to maybe perhaps directly study it in terms of proxies. For proxies, yeah, that's all I can say about that. I'm interested to hear more about how we can, there's other clever uses of data that I'm sure exist in terms of using proxies. And
thank you, Arthur. Another question was from Carmen, who was interested to know if we counted the type of support, and was the unemployment dependent on the magnitude of the financial support that was taken into consideration. So maybe Adi can answer that question as he worked on employment laws. Adi? Would you like to take that question?
If he is not available, I would like to take this question.
Okay, I just unmuted him, so in case he wants to. Either of you, please go ahead.
Yeah, hi. So I was muted. So I was talking on the mute. So yeah, first of all, thanks Arthur and Kritika for a great talk, and for Omdena for giving me this unique opportunity. So what I would say is, yes, we did consider that for some countries. So I can give like a couple of examples. So like in the US, we saw that once the unemployment rate spiked up after the lockdowns were imposed with high stringency, so the government provided like the highest ever stimulus package, which still covered, which was directed towards small businesses and individuals. And we can also track like a 2-week period over which that whole support money was consumed. And then you can see a kind of decrease in unemployment rate if you look at the weekly numbers because of that support. But again, that was still not enough to cover in all aspects of economy as big as the US. So there was still a lot of need for support, and they did provide another small stimulus package towards the end of April. So we can kind of track that as well. And another example would be, I think Japan, where we saw that they again enacted some small fiscal measures towards the beginning before they ramped up their stringency. And then they saw like a small increase in unemployment in March, and then they followed that up with a much bigger stimulus package, presumably to control whatever damage was done. So yeah, I mean, it definitely matters, the size of the income support. And as Arthur pointed out, we also saw some correlation with kind of countries that preempted the coming economic crisis and provided support before they ramped up their stringency.
Thank you, Adi. Another question is from Asad, who was interested to know where countries like India and Pakistan are currently under a locust attack, he says. So with economies depending on agriculture, do you think overlapping of natural calamities will suppress the vulnerable portions of the community?
Absolutely.
Maybe Rohit can answer this question.
Yeah, see, Rohit.
Or Arthur, please go ahead.
I can go ahead while Rohit is being unmuted. So when we consider vulnerability, we have to consider it with respect to what policy. And so there's different policies are going to make different populations more or less vulnerable. For example, like health policy could affect someone who's economically well off, but maybe not well off in terms of their health. So in terms of the agriculture sector, I think that natural calamities would absolutely be something interesting to explore more specifically. So like what policies would what policies could affect farmers might be something to look into.
Okay, sure. Unless anybody wants to add to that, maybe we can go on to the next question. So again, from Ruud Vermeulen, confirmed cases seems an unreliable number as it depends on testing and probably correlates with other factors. So have you tried to estimate real COVID cases and cover casualty?
Sorry, so, okay, Rohit can take that.
Rohit is interested, yeah.
Yeah, so, so thanks. I think in terms of the testing data, I think it's really a bit of a holy grail. Different countries have had sort of different sort of methodologies of testing, and that's something that we sort of really found out as we were going through the data. Because one of the interesting things about the data was that same individual had been like tested 2 or 3 times, and at times some countries were counting it as 3 different tests. Some countries are counting it as one single test. So that's something I think that clarity will emerge in terms of the testing rates. I think that will emerge as the time passes by. Clearly, I think testing rates there's no sort of standard definition right now around the whole testing rate scenario. So that piece is sort of really evolving, and I think the same thing holds true even for the death rates. That's what we sort of figure out, and frankly, at times it is a bit of a political decisions as well. A lot of countries are trying to suppress the official COVID death rates, etc. So I think both testing and death rates, I would say, rather than giving an answer right now, I think we need to look at it. I think 3 months from now, I think in terms of more reliability of data per se. Thanks.
Thank you, Rohit. Another question that came from Susan was that real COVID cases are also difficult to judge. Are people dying from COVID or with COVID? So we would need to define this well for real COVID cases to be accurately measured. So this is a question of measurement. Would you like to take that, Kritika or Arthur? Or even LK?
Okay.
One thing that we were considering is, so we were considering between cases and deaths. And deaths are very ambiguous. You don't really know whether it was the comorbidities or it was the coronavirus that caused the death. And so at least with cases, it's a little less ambiguous in that if you were tested positive, there's some certainty that you have it. However, it's really not clear if that is an accurate measurement of the number of cases in general. And so, because different countries are doing different testing measures, some countries are not testing at all. And so, I think it's a challenge right now that the publicly available data doesn't reflect a lot of the things that we want to study and allow us to pull apart a lot of the factors that we'd be more interested in kind of apart. So it's kind of, what we were seeing from our different data sets was that it was just number of cases, and that again is probably not enough to really determine what's going on. So for future work, maybe we could, future data sets that would, let's say another pandemic happened. I'm hopeful that the infrastructure that we're laying down now will allow us to gather data more efficiently and also from different metrics that we'd be interested to kind of converge on an overall picture. It's a great question.
Thank you. Mariam asks, in the context of the US, vulnerability is deeply rooted in racial disparities, and in each country, vulnerability might be defined differently. That might be a challenge when trying to universalize the definition.
Absolutely.
So another way of thinking about this question is that so racial discrimination, it's also a question of access, right? Access to opportunities, access to healthcare. So I think if we're looking at different factors, so racial discrimination alone shouldn't be a major factor concerning the people who are suffering these racial discriminations. They are going to have a lack of access, right? So I think these can adequately cover all the aspects.
I think one interesting thing to maybe consider to kind of, so coronavirus cases and racial information, yeah, that's something that can be studied. You can also think about different policies that have been enacted and a decrease of something that really is kind of racially driven, like for example, police brutality cases or something like that. And so we can start thinking about if you measure when a policy was enacted, if you can see a corresponding change in this target variable. And so how you choose the variables, if they're sensitive to someone's racial profile or not, is really dependent on your analysis.
Thank you both.
Yeah.
Mauricio has a question to ask. He says, Mauricio was one of the experts who worked with us on this challenge and guided us. So Mauricio says, please comment on the prospects for an AI-enabled policy analysis framework that considers goals, objectives, and criteria of measurable dimensions of the objectives to evaluate alternative policies and policy gaps with a set of objective measures.
Yeah, I told Mauricio that an answer to that question would be a PhD thesis, but he asked it again. So maybe five years. But I think what we looked at, just generally speaking, if you have data, you can do something with it. And so we found news articles very useful for measuring kind of the state of something that we don't have access to immediately. For example, domestic violence cases. So Elke would be a great person to talk more about kind of the AI-driven method and how she used it in her task. In general, though, I see just as a whole that satellite images are really useful sources of data, news articles. And so you can really kind of track things that you can't track directly. So if you don't have direct access, you can always look to these sources for indirect access. And so I think Elke is unmuted, so.
Yeah. Hi. Yeah, I agree with your answer. I think, yeah, it can take a lot more research to further study certain relationships. I think for domestic violence, we took a really basic approach in machine learning, using a simple regression model, as we only had 2 variables. So study what is the impact of mobility decrease on domestic violence increase. But yeah, it's an example of a first step of a model that you could build to use it to quantify effects of policies in the future.
Okay, also, can you explain a little bit more about topic modeling? I think maybe that was used also in your approach.
Yeah. So we took a 2-step approach to study domestic violence. First step was to look at the news articles. And as was shown in the slides, we saw an increase in the number of news articles related to both COVID-19 and domestic violence. To judge whether we were considering the right news articles, we used topic modeling to get a grip on what is inside these news articles. And one of the topics, illustrated by a word cloud, showed us that we were considering the right news articles in our analysis.
Rosanna also wanted to add to that. Rosanna, please go ahead. Rosanna, you can
okay.
Yeah.
So hello everybody. Yeah, just a comment also on the prospects of AI. I think not so much about techniques, but I think the power of AI for all these global problems that we face these days. Now is the pandemic, but there is war. There are so many other things that can be helped. Is that we are in this data phase of humankind history. So this is like what we discussed many times. This is the first time that we have so much data available. I mean, that we still have the problem with data available for some specific problems, but we do have a lot of data available. And to make sense of all of this is what technologies give us the help, because otherwise we would need so many people to actually sit together and analyze all these things. And then we have the power of technology that can just make it faster for us, because we just have so much data available that needs to be processed and understood. And, like, for example, even when we talk like about some specific techniques, for example, for clustering, that you just cluster all this information that we have together, and then something that not necessarily would make sense to us just on a first glance, even for experts. It just makes it easier for the experts to process and to just come to solutions like more fast. Yeah, that's all I have to say.
Thanks, Rosanna. That was helpful. Another question was how governments are trying to judge how we're trying to judge how reliable the data is that the governments across the world are providing, because there is known to be severe manipulation of the statistics as well across the world.
So to answer that question, so yes, completely agree. Governments have been very manipulating when it comes to open sourcing the data. So just to quote an example, so I recently read that in India, the testing rates are very high, but there is like a time lag of 10 days, 15 days. So it depends on the different states which are testing. So this data set, Huffington Post posted about this lag, and the very next day, so the main states that are suffering, they are the states that are having the maximum cases, so their data disappeared the next day. So yes, finding proper data, finding reliable data is a very big issue. And so we try to find as much data as possible relying on United Nations sources. But again, countries have to be very transparent, and they need to understand the power that comes with data-driven policy making, data-driven decision making, to make the lives better for the citizens.
Thank you, Kritika. Thank you, Arthur and Kritika. This was the last question that we took. And I just want to thank all of the collaborators and the presenters for doing such a great job and for the hard work that they put in. Please continue to stay connected with Omdena, and all of our data and work is available in the open domain for everybody to work on and access in the future. I'm now handing over to Laura to conclude. And thank you so much for all of you who took out time to join and be part of our journey. Laura, over to you.
Thank you, Devika, and thank you, presenters. Devika, you covered those thank yous beautifully. We really appreciate everyone attending today and your excellent comments and questions. Please, as Devika said, stay in touch. We'll be staying in touch with you. You may have seen in the comments, in the chat, that I posted about our next demo day presentation, where we'll be sharing the results of a project done in partnership with the World Resources Institute, where we use natural language processing to detect land conflicts in India, that, as described in news reports, matching those to relevant government policies. So we're excited to share that with you. If you're interested, you can find the registration in the same place that you found the registration for this one, on our website in the events section, and I'll post the URL again. But thank you again for attending today. We appreciate it.
Thank you all.